Best free CNA practice test with answers. Question 1. While eating dinner, a client starts to choke and turn blue. What should the nurse aide do? Option A. Remove the food tray and find the nurse. Option B. Slap the client on the back. Option C. Call for assistance and perform the Heimlich maneuver. Option D. Give the client a drink of water. The correct answer is option C. Call for assistance and perform the Heimlich maneuver. Abdominal thrusts are the emergency intervention for a complete airway obstruction. Question 2. When giving evening care to a client with a full set of dentures, where should they be placed? Option A. In the bathroom on the sink. Option B. In a tissue on the bedside stand. Option C. Under the client's pillow. Option D. In a denture cup with the client's name on it. The correct answer is option D. In a denture cup with the client's name on it. Storing dentures in a labeled cup with water prevents them from being lost, damaged, or drying out. Question 3. What type of fire can be safely put out with water? Option A. Electrical fire. Option B. Grease fire. Option C. Paper fire. Option D. Chemical fire. The correct answer is option C. Paper fire. Water is only used for Class A fires, which involve common combustibles like paper, wood, and cloth. Question 4. Which of the following is not a primary fire prevention measure for a nurse aide? Option A. Taking cigarettes and matches away from all visitors. Option B. Being aware of the locations of fire extinguishers. Option C. Reporting damaged wiring or sockets. Option D. Participating in fire drills. The correct answer is option A. Taking cigarettes and matches away from all visitors. Staff enforce smoking policies but do not typically seize property from visitors without specific authority. Question 5. What should a nurse aide put on a client's feet before helping them walk to a chair? Option A. Socks or stockings only. Option B. Cloth-soled slippers. Option C. Rubber-soled slippers or shoes. Option D. Nothing. The correct answer is option C. Rubber-soled slippers or shoes. Non-skid footwear is essential to provide traction and prevent falls during ambulation. Question 6. What is the most important reason for using soap and water to clean a client's skin after elimination? Option A. To keep the client happy. Option B. To prevent soiling of bed linen. Option C. To remove feces and urine from the skin. Option D. To keep the linen costs down. The correct answer is option C. To remove feces and urine from the skin. Urine and feces are caustic to the skin and must be thoroughly removed to prevent breakdown. Question 7. A nurse aide should refuse to perform a task in which situation? Option A. The nurse aide has not been trained to do it. Option B. The client is difficult to deal with. Option C. The nurse aide can find someone else to do it. Option D. The nurse aide is at the end of the shift. The correct answer is option A. The nurse aide has not been trained to do it. Performing tasks without proper training is a safety violation and a liability risk. Question 8. Before helping a client into a bath or shower, what should the nurse aide do first? Option A. Check the temperature of the water. Option B. Shampoo the client's hair. Option C. Soak the client's feet. Option D. Apply lotion or oil to the skin. The correct answer is option A. Check the temperature of the water. Checking the water temperature prevents accidental burns to the resident's skin. Question 9. When taking a client's radial pulse, where should the nurse aide's fingertips be placed? Option A. On the chest. Option B. On the wrist. Option C. On the neck. Option D. On the elbow. The correct answer is option B. On the wrist. The radial pulse is located on the inner wrist on the thumb side. Question 10. To whom does the nurse aide report directly? Option A. The nurse supervisor. Option B. The physician. Option C. The staff development nurse. Option D. The administrator. The correct answer is option A. The nurse supervisor. The charge nurse or nursing supervisor is the immediate superior in the clinical chain of command. Question 11. When communicating with the client's family, what should the nurse aide do? Option A. Listen to concerns and offer support. Option B. Offer advice about the client's medical treatment. Option C, get involved in family problems. Option D, share the latest facility gossip. The correct answer is option A, listen to concerns and offer support. Providing a supportive, professional ear is part of psychosocial care for the family. Question 12. While making an empty bed, a nurse aide sees that the side rail is broken. What should they do? Option A, wait for the next safety check to report it. Option B, report the broken side rail immediately. Option C, tie the side rail in the raised position. Option D, warn the client to be careful. The correct answer is option B, report the broken side rail immediately. Broken equipment is a safety hazard that must be reported to maintenance or the supervisor at once. Question 13. A client is incontinent of urine right before dinner. What should the nurse aide do? Option A, take the client to the dinner table and clean up later. Option B, clean the client and take them to dinner as soon as possible. Option C, tell the client not to eat until they have changed themselves. Option D, insist that the client eat dinner in their room. The correct answer is option B, clean the client and take them to dinner as soon as possible. Maintaining the resident's dignity and hygiene is a priority before taking them to a public area. Question 14. A radio cord is draped across a chair to reach an outlet. What is the first thing the nurse aide should do? Option A, tell the client the radio is a hazard and take it away. Option B, unplug the radio and ask the client not to use it. Option C, see if changes can be made so the radio can be plugged in safely. Option D, take the radio to the activities room. The correct answer is option C, see if changes can be made so the radio can be plugged in safely. The goal is to maintain safety while respecting the resident's rights and personal property. Question 15. A fire alarm is activated while a nurse aide is walking with a resident in a wheelchair. What should the aide do? Option A, push the wheelchair out of the hallway and carry the client. Option B, leave the client to search for help. Option C, comfort the client while moving to a safe place. Option D, lock the wheelchair and check the area for smoke. The correct answer is option C, comfort the client while moving to a safe place. Keeping the resident calm and moving them away from danger is the correct emergency response. Question 16. A nurse aide sees a client spill water on the floor in the hall. What should they do? Option A, call the nurse. Option B, clean up the spill immediately. Option C, call housekeeping. Option D, leave the spill. The correct answer is option B, clean up the spill immediately. Promptly cleaning up spills is every staff member's responsibility to prevent falls. Question 17. For safety, when leaving a client alone in a room, what should the nurse aide do? Option A, keep the door tightly closed. Option B, place the signaling device within the client's reach. Option C, apply a restraint to the client. Option D, leave the bed elevated in the highest position. The correct answer is option B, place the signaling device within the client's reach. The call light is the resident's primary safety link to the staff when they are alone. Question 18. Physical restraints are used most often for which purpose? Option A, to prevent client injury. Option B, when staff is short. Option C, at the family's request. Option D, at the roommate's request. The correct answer is option A, to prevent client injury. Restraints are a safety intervention used as a last resort when the resident is at risk of harm. Question 19. If a nurse aide is concerned about client care, whom should they speak to first? Option A, another nurse aide. Option B, the nurse in charge. Option C, the director of nursing. Option D, the administrator. The correct answer is option B, the nurse in charge. Concerns should always be taken to the immediate clinical supervisor according to the chain of command. Question 20. When taking an oral temperature, it is important to do which of the following? Option A, place the thermometer in the rectum. Option B, place the thermometer under the arm. Option C, place the thermometer under the tongue. Option D, put lubricant on the thermometer. The correct answer is option C, place the thermometer under the tongue. Placing the probe in the sublingual heat pocket under the tongue ensures an accurate oral reading. Question 21. Pressure sores can often be prevented if the client is treated how? Option A, placed in an incontinence brief. Option B, positioned with a pillow under the head. Option C, dressed in loosely fitting clothing. Option D, turned or repositioned every 2 hours. The correct answer is option D, turned or repositioned every 2 hours. Relieving pressure from bony prominences at regular intervals is the most effective prevention strategy. Question 22. If a client has hand tremors, what should the nurse aide do? Option A, restrain the hand that has the tremor. Option B, assist the client with the activity of daily living as needed. Option C, tell the client to stop shaking. Option D, do everything for the client. The correct answer is option B, assist the client with the activity of daily living as needed. Nurse aides should promote independence while providing support for tasks the resident cannot finish alone. Question 23. When assisting a client in resolving grievances, to whom should the nurse aide report? Option A, the doctor. Option B, the family. Option C, the administrator. Option D, the nurse in charge. The correct answer is option D, the nurse in charge. Immediate resident complaints should be reported to the supervising nurse for resolution. Question 24. Avoiding unnecessary exposure of the client during care protects which right? Option A, privacy. Option B, confidentiality. Option C, personal choice. Option D, personal hygiene. The correct answer is option A, privacy. Residents have the right to have their bodies and private procedures shielded from public view. Question 25. How should the female perineum be cleansed? Option A, from front to back. Option B, without soap. Option C, with a disinfectant. Option D, from back to front. The correct answer is option A, from front to back. Washing from front to back prevents the migration of bacteria from the anal area to the urinary tract. Question 26. When caring for a client from another country, what should the nurse aide do? Option A, be sensitive to the client's cultural needs. Option B, force the client to follow facility practices. Option C, promote group activity participation only. Option D, decline to care for the client. The correct answer is option A, be sensitive to the client's cultural needs. Cultural sensitivity is part of providing person-centered and respectful care. Question 27. How often should a nurse aide give an unconscious client oral hygiene? Option A, at least every 2 hours. Option B, at least every 4 hours. Option C, at least every 6 hours. Option D, at least every 8 hours. The correct answer is option A, at least every 2 hours. Unconscious residents need frequent mouth care to keep tissues moist and prevent infection. Question 28. Which action makes the procedure of moving a resident to a wheelchair safe? Option A, place the bed in the low position. Option B, place a pillow on the wheelchair seat. Option C, lower both footrest pedals before the transfer. Option D, release the wheel brakes. The correct answer is option A, place the bed in the low position. Lowering the bed allows the resident's feet to reach the floor, which is critical for a safe transfer. Question 29. A visitor enters the room while the nurse aide is changing the client. How should the aide respond? Option A, can you not knock? Option B, hi, come on in. Option C, boy, he was dirty today. Option D, would you please wait in the lobby? The correct answer is option D, would you please wait in the lobby? The aide must maintain the resident's privacy and dignity by asking the visitor to wait elsewhere. Question 30. A client looks forward to playing bingo each morning. What should the nurse aide do? Option A, tell the client they do not have time to get them ready. Option B, plan the schedule so the client is ready in time for bingo. Option C, tell the client they forgot, but can go tomorrow. Option D, ask the client to bathe and dress themselves entirely. The correct answer is option B, plan the schedule so the client is ready in time for bingo. Supporting a resident's participation in social activities is part of their psychosocial care plan. Question 31. A confused client is begging to go home. What is the best response? Option A, tell the client, this is your home. Option B, take the client to the activity room. Option C, ask the client to tell you about their home. Option D, tell the client you will take them home later. The correct answer is option C, ask the client to tell you about their home. Validation therapy and active listening help soothe a confused resident without arguing with their reality. Question 32. If an alert and oriented client touches a nurse aide inappropriately, what is the best response? Option A, slap the client's hand. Option B, step back and ask the client not to do it again. Option C, refuse to care for the client. Option D, warn the client that they will be punished. The correct answer is option B, step back and ask the client not to do it again. Setting clear professional boundaries firmly and calmly is the correct protocol for inappropriate behavior. Question 33. An Alzheimer's resident moves belongings of other clients. What should the nurse aide do? Option A, return the client to their room and close the door. Option B, find the missing articles and return them. Option C, walk with the client at all times. Option D, tell other clients the resident is harmless. The correct answer is option B, find the missing articles and return them. Managing dementia symptoms involves correcting the results of behaviors with patience and tact. Question 34. Which of the following is considered a restraint alternative? Option A, a lap buddy or tray. Option B, a sedative. Option C, effective pain management. Option D, a hand mitt. The correct answer is option C, effective pain management. Addressing the underlying cause of agitation, such as pain, can eliminate the need for physical restraints. Question 35. How can nurse aides best provide a client with a sense of security? Option A, by rushing through care tasks. Option B, by leaving the room without speaking. Option C, by explaining all routines and procedures. Option D, by talking to another aide while providing care. The correct answer is option C, by explaining all routines and procedures. Clear communication and predictability help residents feel safe in their environment. Question 36. When caring for a client using a restraint, what should the nurse aide do? Option A, assess the client once every hour. Option B, ensure the protective device is very tight. Option C, check the client's body alignment. Option D, release the device once per shift. The correct answer is option C, check the client's body alignment. Maintaining proper alignment and monitoring circulation are critical for residents in restraints. Question 37. What should the nurse aide do first when changing an ostomy bag? Option A, put on gloves. Option B, wash hands. Option C, explain the procedure to the client. Option D, wash the area around the stoma. The correct answer is option C, explain the procedure to the client. Communication and obtaining consent are the first steps of any physical procedure. Question 38. When giving a back rub, what should the nurse aide do? Option A, use a circular motion over bony areas. Option B, position the client in a supine position. Option C, use short, light strokes. Option D, warm the lotion in the microwave. The correct answer is option A, use a circular motion over bony areas. Circular motions help stimulate circulation to the skin and underlying tissues. Question 39. What is the first thing a nurse aide should do when finding an unresponsive client? Option A, start chest compressions. Option B, call for help. Option C, close the door. Option D, call the family. The correct answer is option B, call for help. Summoning emergency assistance is the absolute priority when a life-threatening situation is found. Question 40. When operating a manual bed, what should the nurse aide remember to do? Option A, elevate the client's head at all times. Option B, lock the wheels when the cranks are folded. Option C, fold the cranks under the bed. Option D, keep the bed in the neutral position. The correct answer is option C, fold the cranks under the bed. Folding the cranks prevents them from being a safety or tripping hazard for staff and residents. Question 41. In what position should a nurse aide place an unconscious person for oral care? Option A, supine. Option B, lateral. Option C, prone. Option D, Sims position. The correct answer is option B, lateral. A side-lying or lateral position allows fluids to drain from the mouth and prevents aspiration. Question 42. Where should the nurse aide place soiled linen? Option A, on the floor. Option B, on a chair. Option C, in the dirty linen container. Option D, on the overbed table. The correct answer is option C, in the dirty linen container. Proper disposal of soiled linen in the designated container is essential for infection control. Question 43. What is the best razor to use when shaving a diabetic client? Option A, a safety razor. Option B, an electric razor. Option C, a disposable razor. Option D, a straight edge razor. The correct answer is option B, an electric razor. Electric razors have the lowest risk of causing nicks or cuts, which is vital for diabetic safety. Question 44. How should a nurse aide communicate with a client who only speaks a foreign language? Option A, use gestures. Option B, speak slower and louder. Option C, listen and say nothing. Option D, use an interpretation guide or service. The correct answer is option D, use an interpretation guide or service. Ensuring accurate communication requires professional translation tools or services. Question 45. When transferring a client to a different unit, what is the most important information to get from the nurse? Option A, the phone number to the client's room. Option B, the client's medical diagnosis. Option C, the name of the client's spouse. Option D, the client's name and new room number. The correct answer is option D, the client's name and new room number. Correct identification and the specific new location are required for a safe and accurate transfer. Question 46. What is the main purpose of continuing education for the nurse aide? Option A, client safety. Option B, review of basic skills. Option C, facility compliance. Option D, promoting teamwork. The correct answer is option A, client safety. Ongoing training ensures that nurse aides stay current on the latest safety and care standards. Question 47. Why are incident reports written? Option A, to inform the physician. Option B, to notify family members. Option C, to identify who is at fault. Option D, to determine patterns and trends. The correct answer is option D, to determine patterns and trends. Analyzing reports helps the facility identify systemic issues and improve overall resident safety. Question 48. Adaptive devices like button hooks and sock assists are part of what kind of care? Option A, restorative and rehabilitation. Option B, activities of daily living only. Option C, disability and reactivity. Option D, prosthetic mobility. The correct answer is option A, restorative and rehabilitation. Restorative care uses tools to help residents regain or maintain their independence in daily tasks. Question 49. When ambulating an unsteady client, what is the best tool for the nurse aide to use? Option A, a walker. Option B, a gait belt. Option C, a quad cane. Option D, a wheelchair. The correct answer is option B, a gait belt. A gait belt provides the aide with a secure point of contact to support the resident's balance. Question 50. The client's Bill of Rights includes which of the following? Option A, free medical care. Option B, freedom of choice. Option C, access to the medicine cart. Option D, access to the laundry room. The correct answer is option B, freedom of choice. Autonomy and the right to make personal choices are fundamental rights for all residents. Question 51. Which of the following statements might strongly support that a client is considering suicide? Option A, I think I need to see a psychiatrist. Option B, I might as well be dead. Option C, I do not really care. Option D, we all have to go sometime. The correct answer is option B, I might as well be dead. Direct verbal expressions of a desire to die must be taken seriously and reported immediately. Question 52. A client answers every question by nodding and saying yes. How should the nurse aide respond? Option A, inform the nurse of the behavior. Option B, ask a family member to translate for the client. Option C, speak to the client with multiple medical terms. Option D, shout at the client when assisting with care. The correct answer is option A, inform the nurse of the behavior. Abnormal communication patterns can signal a medical or cognitive change that needs nursing assessment. Question 53. If a nurse aide realizes they gave a client the wrong diet, what should they do? Option A, report the error immediately to the nurse. Option B, ignore the error and move to the next task. Option C, remove the evidence of the error. Option D, blame another nurse aide for the error. The correct answer is option A, report the error immediately to the nurse. Honest reporting of medical errors is necessary to monitor the resident for potential adverse effects. Question 54. If a hearing aid is not in use, what should be done with it? Option A, placed in the client's pocket. Option B, left turned on. Option C, have the battery removed. Option D, left on the bedside table. The correct answer is option C, have the battery removed. Removing the battery prevents it from draining and prevents the device from making high-pitched feedback noises. Question 55. A family member asks what medication a client is receiving. What should the nurse aide do? Option A, allow the family member to read the medication list. Option B, tell the family member the names of the medications. Option C, refer the family member to the nurse. Option D, give the family member the client's chart. The correct answer is option C, refer the family member to the nurse. Nurse aides are not authorized to discuss medications, this is a responsibility of the licensed nurse. Question 56. A client has religious beliefs that do not allow certain foods. To whom should the nurse aide report this? Option A, the dietitian. Option B, other nurse aides. Option C, the charge nurse. Option D, the client's family. The correct answer is option C, the charge nurse. Reporting through the chain of command ensures the care plan and dietary orders are officially updated. Question 57. An independent resident now asks for help walking to the bathroom. What is the appropriate response? Option A, assist the resident and report the change to the charge nurse. Option B, understand that these changes are just a normal part of aging. Option C, update the resident's care plan yourself. Option D, encourage them to try going on their own. The correct answer is option A, assist the resident and report the change to the charge nurse. Any sudden decline in functional ability must be assessed by a nurse for a potential underlying medical cause. Question 58. What should a nurse aide do with a used disposable razor? Option A, throw the razor away in a trash can. Option B, place the razor in a sharps container immediately. Option C, clean, rinse, and dry it for reuse. Option D, wrap the razor in a paper towel. The correct answer is option B, place the razor in a sharps container immediately. Used razors are hazardous sharps and must be disposed of in puncture-proof biohazard containers. Question 59. The Health Insurance Portability and Accountability Act is important to the nurse aide because it does what? Option A, allows residents to carry health insurance between facilities. Option B, provides insurance coverage for healthcare workers. Option C, identifies protected health information that must remain confidential. Option D, provides accountability for care across settings. The correct answer is option C, identifies protected health information that must remain confidential. Protecting the privacy and security of resident health data is a legal requirement under this Act. Question 60. Before leaving a resident in their room who needs help walking, what must the nurse aide do? Option A, turn on the television. Option B, make sure the bedpan is within reach. Option C, place the call light where the resident can reach it. Option D, say, remember that you need help to walk. The correct answer is option C, place the call light where the resident can reach it. Ensuring the resident has a way to summon help is the most critical safety step before leaving. Question 61. New swelling is noticed in a resident's ankles during a bath. What is the best response? Option A, ask if the resident has been eating salty foods. Option B, elevate the resident's legs and check again later. Option C, report the swelling to the charge nurse. Option D, avoid bathing the lower legs. The correct answer is option C, report the swelling to the charge nurse. New edema can be a sign of a serious medical condition and must be reported for clinical assessment. Question 62. A resident has a contracture of the right arm. How should the aide put on a button-front shirt? Option A, put the shirt sleeve on the left arm first. Option B, ask which arm the resident prefers. Option C, put the shirt sleeve on the right arm first. Option D, put both sleeves on at the same time. The correct answer is option C, put the shirt sleeve on the right arm first. When dressing a resident with a physical limitation, always dress the affected or weak side first. Question 63. When weighing a resident, what is it important to make sure of? Option A, the resident's last measured weight is available. Option B, the scale measures both pounds and kilograms. Option C, the resident is wearing lightweight pajamas. Option D, the scale is balanced or calibrated before helping the resident onto it. The correct answer is option D, the scale is balanced or calibrated before helping the resident onto it. Ensuring the scale is zeroed or calibrated is necessary to get an accurate weight measurement. Question 64. A resident reports that his wristwatch is missing. What should the nurse aide ask? Option A, if the resident thinks someone took it. Option B, if the resident has checked the lost and found box. Option C, who was assigned on the previous shift. Option D, for permission to help look around the resident's room. The correct answer is option D, for permission to help look around the resident's room. Assisting the resident while respecting their privacy is the first step in locating personal items. Question 65. When a resident wears a restraint, what must the nurse aide make sure of? Option A, the resident is wearing an incontinent brief. Option B, the resident is checked once every 2 hours. Option C, the restraint is applied following the manufacturer's instructions. Option D, the restraint is applied tightly under the clothing. The correct answer is option C, the restraint is applied following the manufacturer's instructions. Following specific manufacturer and facility guidelines is essential for the safe use of restraints. Question 66. When giving perineal care to an uncircumcised male, what should the aide do? Option A, push the foreskin back to clean. Option B, keep the foreskin in place over the penis. Option C, wipe from the base of the penis towards the tip. Option D, cleanse only the tip and the urethra. The correct answer is option A, push the foreskin back to clean. The foreskin must be gently retracted to clean the area where bacteria and secretions accumulate. Question 67. A resident on a toileting schedule asks to go to the bathroom frequently. What should the aide do? Option A, tell the resident that it is not time. Option B, decrease the resident's fluid intake. Option C, ask the resident to follow the schedule. Option D, take the resident to the bathroom as needed. The correct answer is option D, take the resident to the bathroom as needed. Immediate needs for elimination take priority over schedules to maintain dignity and skin health. Question 68. What is the term for areas of the body where bone lies close to the skin? Option A, a skin fold. Option B, a pressure ulcer. Option C, skin breakdown. Option D, a pressure point. The correct answer is option D, a pressure point. Pressure points are anatomical sites that are most vulnerable to developing pressure injuries. Question 69. To prevent skin tears or shearing when moving a resident, what should the aide do? Option A, wear gloves to reduce friction. Option B, avoid pulling or sliding the resident during the move. Option C, tell the resident to be careful. Option D, ask the resident to keep their arms over their head. The correct answer is option B, avoid pulling or sliding the resident during the move. Lifting rather than sliding helps protect fragile skin from mechanical injury. Question 70. If a resident in bed is vomiting, why should they be turned onto their side quickly? Option A, to get the resident into a more comfortable position. Option B, to get towels placed to protect the linen. Option C, to keep the vomit off the resident's face. Option D, to help prevent aspiration. The correct answer is option D, to help prevent aspiration. Turning the resident prevents them from inhaling vomit into their lungs, which is a life-threatening event. Question 71. An incontinent accident happens just before the end of a shift. What should the aide do? Option A, explain that the next shift will assist shortly. Option B, remove wet clothing and place the resident on a dry pad. Option C, ask if the resident feels very uncomfortable. Option D, provide incontinent care to the resident immediately. The correct answer is option D, provide incontinent care to the resident immediately. Care for immediate needs must be provided regardless of the time remaining on a shift. Question 72. A nurse aide enters a room just as a resident's wife slaps him. What should the aide do? Option A, leave the room to allow privacy. Option B, consider if this is normal behavior for the couple. Option C, report the observation to the charge nurse immediately. Option D, tell the wife she must leave the facility. The correct answer is option C, report the observation to the charge nurse immediately. Any act of violence or abuse must be reported to the supervisor immediately for investigation. Question 73. A minister is praying with a resident during routine vital signs. What should the aide do? Option A, ask how long the minister plans to visit. Option B, explain politely that it is time for vitals. Option C, check if the resident is praying before interrupting. Option D, wait to take the vital signs after the minister has left. The correct answer is option D, wait to take the vital signs after the minister has left. Respecting a resident's spiritual activities is a part of providing quality holistic care. Question 74. A nurse asks an aide to perform a task outside their scope of practice. What should the aide do? Option A, consider if the task can be done another way. Option B, provide the care and perform the task anyway. Option C, contact the ombudsman office. Option D, refuse the task and explain it is not within their role. The correct answer is option D, refuse the task and explain it is not within their role. Aide assistants must never perform clinical tasks for which they are not legally certified or trained. Question 75. A dementia resident says she must get home for her daughter's school bus. What is the best response? Option A, let's go see if bingo has started yet. Option B, remember you are in a nursing home, your daughter is grown up. Option C, do you mean your great-granddaughter? Option D, what do you like to do with your daughter when she gets home from school? The correct answer is option D, what do you like to do with your daughter when she gets home from school? Using validation and asking about the memory helps calm the resident without causing distress by correcting them. Question 76. A Jewish resident does not want to attend the facility Christmas party. What should the aide do? Option A, remind the resident how much they enjoy parties. Option B, encourage them to go since everyone else is. Option C, respect the decision and ask what the resident would like to do. Option D, ask if they participated in Hanukkah activities instead. The correct answer is option C, respect the decision and ask what the resident would like to do. Residents have the right to choose their activities and have their religious preferences respected. Question 77. A resident on the floor says they fell and cannot move their arm. What is the next action? Option A, help the resident to a sitting position. Option B, ask the resident to stay still while calling for help. Option C, ask how the fall happened. Option D, support the arm by placing a pillow under the shoulder. The correct answer is option B, ask the resident to stay still while calling for help. If an injury is suspected, the resident should not be moved until a nurse performs an assessment. Question 78. Where should a urinary drainage bag be placed when a resident is in a wheelchair? Option A, on the floor directly next to the wheelchair. Option B, tucked at the resident's side on the seat. Option C, hung from the back of the chair above the bladder. Option D, attached to the chair frame below the level of the bladder. The correct answer is option D, attached to the chair frame below the level of the bladder. Drainage bags must always stay below the level of the bladder to facilitate gravity flow and prevent infection. Question 79. A resident who must stay in bed is at risk for developing which condition? Option A, dementia. Option B, arthritis. Option C, foot drop. Option D, Parkinson's disease. The correct answer is option C, foot drop. Immobility can cause the muscles in the feet to weaken and contract, leading to foot drop. Question 80. When counting a pulse, what should the nurse aide do? Option A, notice if the rhythm of the heartbeat is regular. Option B, ask if the resident takes heart medication. Option C, consider the time of day. Option D, multiply the rate by 4 if counted for 15 seconds. The correct answer is option A, notice if the rhythm of the heartbeat is regular. Observing the rhythm and strength of the pulse provides vital information beyond just the heart rate. Question 81. When a resident is unable to stand, how is their height generally obtained? Option A, having coworkers hold them upright for measurement. Option B, adding the length of legs, chest, and head. Option C, asking the resident and subtracting an inch for age. Option D, taking the measurement from head to heels while they are flat in bed. The correct answer is option D, taking the measurement from head to heels while they are flat in bed. Measuring a supine resident in good alignment is the standard for non-ambulatory height collection. Question 82. To soften the beard before shaving with a disposable razor, what should the aide do? Option A, massage the beard area gently. Option B, rub the beard in the direction of hair growth. Option C, hold a warm, wet washcloth against the face first. Option D, lather the face with soap instead of shaving cream. The correct answer is option C, hold a warm, wet washcloth against the face first. Warm moisture softens hair and skin, resulting in a closer shave with less irritation. Question 83. A trash can is on fire in a resident's room. What should the nurse aide do first? Option A, use the resident's pitcher of water to put it out. Option B, open the window to allow smoke to escape. Option C, remove the resident from the room. Option D, yell fire along with the location. The correct answer is option C, remove the resident from the room. The first priority in any fire emergency is to rescue anyone in immediate danger. Question 84. A reddened area is found on a comatose resident's hip. What will the nurse likely request? Option A, massage the area using lotion. Option B, apply a dry protective dressing over the area. Option C, keep the resident positioned to avoid pressure on the hip. Option D, cleanse the hip using extra soap. The correct answer is option C, keep the resident positioned to avoid pressure on the hip. Relieving pressure is the most important step in preventing a reddened area from becoming an open ulcer. Question 85. Which healthcare team member counsels families and arranges for needed services? Option A, dietitian. Option B, social worker. Option C, physical therapist. Option D, activities director. The correct answer is option B, social worker. Social workers handle the psychosocial and discharge planning needs of residents and families. Question 86. When a person is receiving end-of-life care, what is likely to be included in the care plan? Option A, ways to best provide for the comfort of the resident. Option B, exercises to improve the resident's strength. Option C, frequent observation to prevent confusion. Option D, instructions for postmortem care. The correct answer is option A, ways to best provide for the comfort of the resident. The focus of hospice and end-of-life care is comfort, dignity, and pain management. Question 87. Hot tea splashes on a resident's hand. What is the first response? Option A, quickly move the resident to the nurse's station. Option B, ask the resident how badly the burned area hurts. Option C, wet a towel with cool water and place it against the injury. Option D, apply antibiotic ointment and cover with a bandage. The correct answer is option C, wet a towel with cool water and place it against the injury. Cooling a minor burn with water immediately helps stop the burning process in the tissues. Question 88. An aide is assigned to provide postmortem care but has never done it. What is the best response? Option A, ask another aide to trade assignments. Option B, provide the care since the resident cannot be harmed. Option C, talk to other aides about how to do it. Option D, discuss the lack of experience with the nurse. The correct answer is option D, discuss the lack of experience with the nurse. Professional integrity requires admitting when you need guidance to perform a procedure correctly. Question 89. Which action is most helpful to help decrease a resident's incontinence? Option A, leaving the bedpan in place for extra time. Option B, putting an incontinent brief on the resident. Option C, answering the resident's call light quickly. Option D, controlling fluid intake throughout the day. The correct answer is option C, answering the resident's call light quickly. Promptly responding to the urge to urinate is the best way to help maintain continence. Question 90. What is the nurse aide's role in a bowel and bladder retraining program? Option A, being consistent with carrying out the toileting schedule. Option B, notifying the family of the program. Option C, determining the type of program suited for the resident. Option D, checking the resident every 4 hours. The correct answer is option A, being consistent with carrying out the toileting schedule. Consistency in following the specific time schedule is the key to successful retraining. Question 91. A resident with advanced directives has a do not resuscitate order. What does this mean? Option A, they do not remember current events. Option B, they should not be restrained. Option C, they do not respond to instructions. Option D, they should not be resuscitated. The correct answer is option D, they should not be resuscitated. A do not resuscitate order means medical staff will not perform cardiopulmonary resuscitation if the heart stops. Question 92. A resident's husband starts telling the aide how to care for his wife. What should the aide do? Option A, accept that the husband has always been in charge. Option B, explain that the nurse aide is certified and able to care for her. Option C, suggest the husband participate in the care conference. Option D, understand that the husband wants staff aware of his wife's needs. The correct answer is option D, understand that the husband wants staff aware of his wife's needs. Acknowledging the family's input helps build trust and ensures the resident's preferences are met. Question 93. What does the term vital signs refer to? Option A, any important information about a resident's condition. Option B, the color, condition, and appearance of the skin. Option C, fluid intake and output. Option D, temperature, pulse, and respirations. The correct answer is option D, temperature, pulse, and respirations. Vital signs are the clinical measurements used to assess the most basic body functions. Question 94. How can the nurse aide help the resident have regular bowel movements? Option A, making sure the resident gets a lot of rest. Option B, providing a routine time for the resident to toilet. Option C, giving the resident cereal for breakfast every morning. Option D, keeping a bedpan within reach in bed. The correct answer is option B, providing a routine time for the resident to toilet. Establishing a predictable routine helps regulate the body's natural elimination patterns. Question 95. A resident keeps coughing after each drink of fluids. What is the appropriate response? Option A, give the resident more time to swallow. Option B, keep the amount of fluid small by using a spoon. Option C, add thickener to the fluid. Option D, stop the feeding and report to the charge nurse right away. The correct answer is option D, stop the feeding and report to the charge nurse right away. Persistent coughing during intake is a sign of aspiration risk and must be assessed by a nurse. Question 96. A new admission needs help to the bathroom before their care plan is done. What should the aide do? Option A, ask the resident to use a walker. Option B, get another nurse aide's help to walk the resident. Option C, position a commode chair next to the resident. Option D, ask the charge nurse for instructions on what help is needed. The correct answer is option D, ask the charge nurse for instructions on what help is needed. Safety is the priority. The aide must follow specific nursing instructions until the plan is finalized. Question 97. What is the main purpose of a restorative care program? Option A, ensure the resident can return home. Option B, provide meaningful activities for the resident. Option C, help the resident improve their level of functioning. Option D, provide assistance with activities of daily living. The correct answer is option C, help the resident improve their level of functioning. Restorative nursing focuses on helping residents reach and maintain their highest level of independence. Question 98. A resident is nothing by mouth because of nausea. What should the aide do? Option A, give the resident fluids in small amounts. Option B, provide the resident with a small cup of ice chips. Option C, ask if the resident can handle any fluids. Option D, remove any fluids at the bedside including the water pitcher. The correct answer is option D. Remove any fluids at the bedside, including the water pitcher. Nothing by mouth means zero oral intake. Removal of fluids prevents accidental consumption. Question 99. A resident's elbow is stiff and will not bend during range of motion. What should the aide do? Option A. Continue exercises but move on to another joint. Option B. Continue since stiff joints are a normal part of aging. Option C. Apply gentle pressure to try to bend it. Option D. Suggest the resident see a physical therapist. The correct answer is option A. Continue exercises but move on to another joint. Never force a joint. Skipping the stiff area and reporting the finding is the safe protocol. Question 100. Which of the following describes the daily routine needs of residents with dementia? Option A. The resident's day should be kept full of activities. Option B. Changing the daily routine is often helpful. Option C. Providing opportunities for activity and periods for rest is important. Option D. Following a strict schedule is required to decrease confusion. The correct answer is option C. Providing opportunities for activity and periods for rest is important. A balance of stimulation and quiet rest helps manage the symptoms of dementia. Question 101. A dementia resident tries to get out of bed without help at night. What should the aide do first? Option A. Orient the resident to person, place, and time. Option B. Review how to use the call light. Option C. Tell the resident to never get out of bed without help. Option D. Try to find out if there is something the resident needs. The correct answer is option D. Try to find out if there is something the resident needs. Checking for basic needs like pain or a full bladder addresses the reason for the behavior. Question 102. How much assistance does a resident receiving passive range of motion need? Option A. Partial assistance with range of motion exercises. Option B. Full assistance with the aide taking the joints through exercises. Option C. Minimal assistance to just remind the resident. Option D. Minimal assistance to provide support while the resident moves. The correct answer is option B. Full assistance with the aide taking the joints through exercises. Passive range of motion means the staff performs the movement for a resident who cannot. Question 103. When a resident is receiving oxygen, what should the nurse aide do? Option A. Make sure the tubing is free of kinks. Option B. Remove oxygen when the resident is eating. Option C. Place a no visitors sign on the door. Option D. Limit how often mouth care is provided. The correct answer is option A. Make sure the tubing is free of kinks. Unobstructed tubing is necessary to ensure the resident receives the prescribed oxygen dose. Question 104. An open sore is found on a resident's foot during foot care. What should the aide do? Option A. Pat gently to dry and cover with a dry dressing. Option B. Stop the foot care immediately and ask what happened. Option C. Report the skin opening to the charge nurse as soon as possible. Option D. Check the resident's sock for any wound drainage. The correct answer is option C. Report the skin opening to the charge nurse as soon as possible. Breaks in the skin on the feet of the elderly can lead to serious infections and must be reported. Question 105. Which of the following is an example of reality orientation for a resident with early dementia? Option A. Your son plans to visit today at 2 o'clock. Option B. You are in the nursing home. I am here to help you. Option C. This is your daughter Anna. Do you remember her? Option D. Look at the time. Lunch is in 30 minutes. Are you hungry? The correct answer is option D. Look at the time. Lunch is in 30 minutes. Are you hungry? Using external cues like the time and upcoming meals helps keep the resident oriented. Question 106. A resident returns from the hospital after a hip replacement. What should the aide expect? Option A. The resident will be dependent and need total care. Option B. The resident will be confined to bed for several weeks. Option C. The resident will go to physical therapy to increase mobility. Option D. The resident will receive range of motion exercises to the hip. The correct answer is option C. The resident will go to physical therapy to increase mobility. Rehabilitation for hip replacement focuses on early mobility and professional physical therapy.